بسم الله الرحمن الرحيم. السلام عليكم. طلبنا الأعزاء إن شاء الله نكمل المحاضرة مالتنا which is pelvic injuries. The second part of this lecture is fractures of the acetabulum. So, fracture of the acetabulum occurs when the head of the femur is driven into the pelvis. So, it is forced by the head of the femur itself. And according to the force that affecting the acetabulum, the fracture pattern will be there. So there are many classifications, but the most common classification is according to columns. So they classify the fracture acetabulum according to the columns, which is anterior column, posterior column, transverse fracture and complex fractures. راح نجي نشوفها واحدة واحدة ونشوف شنو pattern of each fracture. So what about anterior column fracture? It extends from the pubic symphysis along the superior pubic ramus across the acetabulum to the anterior part of the ilium. It is uncommon, not affected weight-bearing area with good prognosis. So it is a little bit stable one because it is not affect the weight-bearing area. This is very important. You should know that weight-bearing area is the target of stability in the classification. خلينا نشوف. This is the type A fracture, which is anterior column. ياخذ the anterior part of the acetabulum, ياخذ the pubic ramus, while the superior posterior part, which is the weight-bearing area, not affected. So it is a stable fracture with good prognosis, but it's uncommon like others. راح نجي نشوف شنو common type. The posterior column extends from the ischium across the posterior aspect of the acetabular socket to the sciatic notch and the posterior part of the innominate bone. So the fracture of this will affect weight-bearing area, so it is unstable. Usually associated with posterior dislocation of the hip joint, there is a possibility of sciatic nerve injury because it affects the sciatic notch, and internal fixation is needed to be a stable fracture. راح نجي نشوفه. هذا posterior column يبدي من sciatic notch ويمشينا على posterior column of the acetabulum وياخذ الpubic ramus مالته, so it will affect the weight-bearing area, so it is a very unstable injury and should be treated surgically. Transverse fracture, this fracture runs transversely through the acetabulum, involving both the anterior and posterior columns and separating the iliac portion above from the pubic and ischial portions below. A vertical split into the obturator foramen may coexist, resulting in T fracture. Very unstable one, difficult to reduce with very bad prognosis because it's unstable. راح نجي نشوفه. هذا the transverse يبدي anteriorly من anterior column نيجي posterior column ونشوف هذا البارت من innominate bone كل هذا flail part, and we have anterior and posterior part in T-shape one, so it's very unstable, very dangerous, and difficult to treat like this fracture. So this is the transverse with very bad prognosis, of course. What about complex fractures? We have many acetabular fractures are complex injuries, which damaging either the anterior or the posterior columns, or both of them, as well as the roof of the walls of the acetabulum. The injury is severe, the joint surface is disrupted, treatment is usually internal fixation with very bad prognosis because of its complexity. So this type of fracture, complex fracture, longitudinal, this is a flail part of the innominate bone affecting weight-bearing area, may affect anterior, posterior, so it is a very unstable one. الكومبلكس طبعا مو بس هذا ياخذ كلهن يجوز ويا الانتيرير والبوستيرير because it is complex. Okay. What about the clinical feature؟ طبعا وين اشوف يعني لحد يقول لي انه patient جايك يمشي او trivial injury وصاير عنده acetabular fracture like those. لا, this is due to RTA, fall from height, so it's a high violence injury. Put in your mind, RTA, fall from a height, high violence injury may cause fracture pelvis. Usually patients come with shock, especially hypovolemic shock due to profuse hemorrhage. May associated with another fractures, usually fracture femur, whether neck or shaft femur, and even lower limb fracture. دائما نشوف bruising around the hip, and the limb may lie in internally rotation. Neurological examination is essential, and don't forget to do rectal examination. Yes, what we have to diagnose this type of fractures. We can do X-ray, plain X-ray, or more obvious by 3D CT scan. هنا راح نشوف إن عندنا fracture, هنا dislocation central, dislocation right hip, of course. The head of the femur goes into the stabular floor. This is unstable fracture. Okay, and by CT scan it will be more obvious. What about the treatment? Of course, ABC is very essential. Atlas management, shock treatment is very important to do urgent IV cannulas, more than one cannula, and replaced by blood. And skeletal retraction of 10 kg is of value to decrease pain and decrease hematoma for the patient and to be easily to transported. What about non-operative treatment? When traction is released, the hip should remain congruent. So the aim of our treatment is to keep the congruency of the acetabulum itself. So if I put skeletal retraction and I catch the congruity of the acetabulum, so this is enough, no need for surgery. But of course, in unstable one, we should do operation to be more sure for the congruency of the acetabulum. Of course, weight-bearing area fracture is a candidate for surgery. And usually we should exclude posterior wall fracture by doing CT scan because X-ray only is not enough to assess the pattern of the fracture. What we have in operative treatment? We can do operative treatment by putting, as shown below, buttress plate and screws like this one, so to keep the fracture in its real position. Okay. And of course, assessment of the hip joint is very essential to even per-operative to know whether the head is well seated inside the acetabulum and if the acetabulum is congruent or not. What about complications? As you know, complications due to due to hemorrhage, DVT is very common because it is a pelvic injury. So DVT is very common. We can give anticoagulant for patient, but after after controlling of the shock. Sciatic nerve injury, of course, heterotropic or osteoarthritic changes, avascular necrosis of the head because of the dislocation, loss of joint movement, and joint stiffness. Okay. Injuries to the sacrum and coccyx, usually caused by blow from behind, or a fall, which is most common, a fall onto tail, or falling in sitting position, may fracture the sacrum or the coccyx, or sprain the joint between them. Women seems to be affected more commonly than men. Usually there is bruising and is considerable and tenderness felt by the patient when we do palpation for the sacrum and coccyx. Okay, diagnosis, usually plain X-ray is enough to show a transverse or forward angulation. يعني مو شرط نشوف الفراكشر as a fracture بس راح نشوف الكيرف of or angulation of the الكيرف اللي هو ايش عندنا هنا، احنا عندنا هنا kyphosis kyphotic curve، فراح نشوف increase in the angulation, acute angulation, and this is due to the fracture. Treatment, we can reduce it by doing PR, and through the PR we can catch the coccyx and try to elevate it so to abolish the angulation. After that, rubber ring cushion is of value after reduction with local injection of steroid and maybe local anesthesia. And sometimes in chronic patients, which is not respond to local injection, we do excision of the coccyx. هنا راح نشوف هذا الفراكتشر واضح كلش. هنا الانجوليشن تمام. So this is the fracture of the coccyx, and thank you for your listening to this lecture. Thank you.